Under eye bag filler treatment. Why are the results so different on both sides? I have gone to 3 different doctors in the past 2.5 years to use fillers on my under eye area to conceal the bags I started to get. Doctor 1 was amazing. He even took the time to hold the injections to get the ideal finished product. My bags were gone instantaneously. The last 2 doctors, not so good. When I expressed my concerns and explained what Doctor 1 did, it seemed to go on deaf ears. Now I have this complete uneven look. They say they can't go higher up due to lack of bone.
Thank you for your question. You submitted several photos, and you stated in your question that you've been having injectable fillers to help the appearance of your under eye hollow areas, and that you've had one doctor who you felt did a great job and took the time to do some molding, and then subsequent doctors you've gone to did less than an optimal job, and as you said, your concerns would fall on deaf ears when you described how the previous doctor had done the procedure. And you're asking about the question of one doctor stating that you can't fill beyond a certain level because there's no bone. Well, I can certainly give you some guidance as to how I approach patients like yourself in my practice. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. The background of eye surgery and specialty training in plastic surgery, the eyelids, has been a big part of my practice in helping people with under-eye hollows and puffy bags and droopy eyelids is a reason for people who come to us from all over the world. So I certainly am familiar with your concerns and your frustrations. I think that one of the realities of the world we're in is that the names of particular brands, such as injectables or lasers, becomes the star of a procedure. But when you really understand what medicine is about, the true star or the center is the physician who actually performs the procedure. And you certainly recognize the difference in quality in terms of your own comfort as well with the first doctor. And it really is a meeting of the minds where the doctor and the patient have shared values, shared perspectives, and shared understanding of desirable outcomes. You know, I think that the second or any additional physicians that you've been seeing who are trying to achieve comparable results probably felt that they were doing the best they could with your situation, and from their perspective, there is no further benefit to be had. And so the explanation that one came up with where there's no bone to fill where you have an area of concern can be technically true, but if your experience prior was recent enough that there hasn't been enough of a change, then clearly there is a discrepancy there and a frustration. So understanding that yes, there is an art to doing this, and regardless of the anatomy, it is really about what works right for you. In our practice, for example, we will not only do filling of the hollows with a filler like Restylane or a slightly thicker hyaluronic acid filler, but I also routinely use platelet-rich plasma. Now, what the intention of that is to help improve the skin quality, and there may be something to open your eyes to in regards to the possibility that in addition to volume, you may want to consider something that helps skin quality at the same time. So in platelet-rich plasma is basically a concentration of the healing and growth factors that are part of the blood, and when I apply this to the delicate skin under the eyes, it works very well in synergy with a hyaluronic acid filler. In fact, wound healing studies have shown that synergy to be really significant. So the combination of a filler deep and PRP more superficial has been very successful in my practice. But that's more prescriptive and not about the real core of what your issue is. Your issue is finding the right doctor who understands exactly the volume correction that you need. This is very, very much about resonating, and a lot of times you will go to 5, 6, 7 doctors and they will all offer you different solutions. It is routine for me to see patients who have had one thermal tightening device and another one having injectable, and the same one having injectables and other things, trying to attack the same problem. And I can hear from the different approaches that for the doctors they've been to, how every doctor came to their situation from a different perspective. So I think you need to find a doctor you're comfortable with. Instead of debating the validity of your position, certainly anyone looking at your photos can always say, yes, you can have a little bit more here or a little bit more there. But really what you have to find is a doctor who gets you and understands. For example, with our patients, we have patients come back after 2 weeks once we do an injectable filler, and that includes whether it's an injectable like Botox or a filler like Restylane, Juvederm, Voluma. I always have patients come back after 2 weeks because that's about the time when I feel like things have settled out and we can make an appropriate assessment. It's very important to have this connection with the doctor. Almost every day I'm meeting patients who have gone for, let's say, lesser expensive options and various types of entities where the doctor may be working in a high volume or there is no doctor in that entity. There's definitely a lot of options, and I don't mean to vilify any specific specialty, individual practitioner or a business entity, but really, it's really about finding the right doctor. I think finding the right doctor for you will make all the difference in the world. And instead of chasing which one is right in terms of the anatomy, because you'll certainly get a lot of opinions in that respect. So I hope that was helpful. I wish you the best of luck. And thank you for your question.